Welcome, everyone, and thanks so much for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Be sure to speak to your healthcare provider for your unique health needs. Welcome back, everyone, to the Flourishing Life podcast. Tad and Jackie here from Flourish Medical and Wellness. We're listening to you. Our patients is our priority and practicing a team approach to foundational wellness for long-term healing. Today, we are back with our highlights from the month of February.
Yes, we had a great month and lots of new patients coming in and a lot of common themes talking about exercise, nutrition, seasonal affective disorder, even peptides. So
yeah, a lot of peptide stuff going on.
Yeah, and there's so much information right now circulating about peptides, especially on social media, where there's information from reliable sources, information maybe from some not so reliable sources, and people are trying to navigate that. But what are you seeing?
Yeah, I would agree. And I think we had the new kind of update from Kennedy. Peptides had kind of banned, taken off, like, hey, you can't use these, restricted. And now it sounds like there was some work from the higher powers are going to be reinstating some of that. So we'll see. If you live here in Minnesota, it's a little bit hard because some are just restricted
at the
with
state
regard
level
to our state. So
yeah.
We'll see what happens there.
Yeah. And just as a reminder to everybody, peptides are shorter strings of amino acids, those protein building blocks. So what we're looking at is those naturally produced strings of amino acids and how they affect the body in a positive way on areas like GLP-1, which can affect appetite and cravings. We also look at things that affect growth hormone, things that affect mitochondrial health. There are a lot of different areas for peptides if we're allowed to use them in the state of Minnesota. But again, those should always be used with an experienced provider who is able to weave that into a comprehensive program.
Yeah. So one of the cool things that I actually saw a few times in the last month were patients who had decided to wear a CGM or a continuous glucose monitor. And it's funny because we educate and we tell them things like, eat protein first, eat your carbs last, don't eat carbs later in the day, all these types of things. But until, there's some people who need to see it to believe it and start doing those things. So I had several patients who had done that and just made some notes from a couple of them. And the response back was, it validated my belief that eating habits and patterns are not impacting my A1C. So this is the patient where their A1C is high or prediabetes, but you wouldn't think that they have prediabetes. Like, they're fit, they work out, they eat well. So it doesn't make sense, right? And so the CGM can be really helpful in those patients to help us understand, okay, what is driving up your blood sugar then? Is it a response to stress? Is it, we need to change the way you're exercising because that's causing higher stress, which then raises cortisol, which then raises blood sugar. Yep. And so there's a lot of pieces that it can really help us kind of narrow in on when we're using that. Another one said, CGM was an awesome experience. I loved the instant data feedback. It validated the eating protein before carbs and how late night carbs affects glucose during the evening, and how evening walks impacts blood sugars like after eating. So post eating walks really dropped the blood sugar for her. And so super cool. Like, these are the things we tell our patients, but when they get to see it like in real time, I think it's been so eye-opening for patients when we use that tool.
Yeah, and let's dig into this too. So a CGM, a continuous glucose monitor, for those of you who are not familiar with it, it's the little piece where you see people clicking on the back of their arm in this fat right here. There's a tiny filament that has a sensor going into the fat below the skin, and that is what is checking that blood glucose, and it checks it at regular intervals. The cool part with the Stello one that we use is that it can be paired with the app so people can track those changes in nice graphs and nice layouts right to their phone in the app, which gives all that feedback. The other piece, when we look at CGMs, especially in those people who have an A1C that is resistant, it gives us a great idea of not only what they're eating, but when they're eating. Okay, what happens when we shorten that eating window from 9 hours to 7 hours? How does that person's body respond? What happens if we skip breakfast and we just start eating at 11 a.m.? There's lots of different ways we can utilize that CGM, and we can even pair that with blood tests like the A1C, like a fasting insulin, to really get the whole picture of how that person's body is responding. And then also thinking about cortisol with regard to exercise. So you talked about eating before bed, and this is something that I actually did myself. Was I tested with a CGM on what happens if I have that nice 3-hour window of fasting between the end of dinner and bedtime and only water in that period of time. What happens if I have a mix of protein with a carb? And then what happens if I eat half a bag of pretzels, straight carbs and salt? What I found was, like we would expect, very reliable blood glucose activity when there is finishing up a balanced meal for dinner and then a minimum of 3 hours from that finish of dinner until bedtime. Very reliable, no significant up and down roller coaster activity into that first half or any time during sleep for that matter. Just very standard curve. When I looked at a mixed snack in the evening, so thinking about something like sausage with crackers would be an example. You're getting a protein source, you're getting a carb source from the cracker. We'll see some glucose activity, a little bit of that erratic roller coaster ride, but not bad because the protein helps dampen that. And then if you're going to go ham on pretzels or cereal or something like that, it looks like a nasty roller coaster where 3 people fell off on the back and it's doing it for the next 3 to 5 hours during your sleep. And that's where we see such negative effects, not only on that A1C and a fasting insulin level, but also a person's sleep quality. That affects the depth of our sleep, and the 2 big metrics we look at there are REM sleep and deep sleep. That's where we're getting that restorative rest, but has a huge impact on that, and it gives great feedback. If you've never worn a CGM, it's a valuable tool, and they're pretty inexpensive now to wear them for a month and get that feedback for yourself.
Yeah, and the importance of sleep, obviously, is if your body is doing the insulin and blood sugar song and dance, like it will do that. It has to do that. It can't choose not to. So if you're having those later meals, it's going to respond to it, which then means you don't get to your full restorative sleep, which means your immune system is not restoring. You're more likely to be sick frequently. You're not building muscle. You're going to have poor stress response. So a lot of things that are supposed to be happening overnight that are completely disrupted because we're eating late. And so if you're somebody who's like, man, I really like to eat late, and I don't know if this is impacting my sleep, a CGM could be helpful to really
100%.
see what's happening. And then if you're somebody who just wants data, like they're like, you are either doing all the things and you don't know why your levels still look like they do, or you just need to know, like, hey, how does a sandwich impact my blood sugar? Like, you're just curious. It's such a great tool. It's such a great tool. So some of the things we look for, and I'll tell patients, the first week, so get 2 sensors. That will last you a month. 1 sensor lasts for 2 weeks. The first 2 weeks, don't do anything different. Track all of your stuff, your food, your meals, your activity, and make no changes, because this is going to show you what you're doing on a routine basis that's impacting your sugar. And then take those things and start to make the tweaks and adjustments for the next sensor and see how that changes. And so what we're wanting is a more stable, consistent level. We're wanting our sugars to go up no more than 20 to 30 points after a meal. And so if it is going up more, so say you were at 90 before your meal and now you're at 140, we need to tweak the way you're eating. We need to tweak what's in that meal.
Yep.
And then again, looking for those kind of highs and lows overnight is telling us there's some insulin sensitivity and not using insulin and managing blood sugar well. So
absolutely. And the other thing that we've seen for people who get in the habit of having alcohol at night, like, oh yeah, I had 3 hours, from when I finished dinner until bedtime, but I made myself 2 cocktails. That's going to show up on a CGM. No question. Yeah. You're going to see the blood glucose spikes. And everybody listening to this, this isn't about chasing numbers. This is about looking at something called insulin resistance. And insulin resistance is an epidemic in this country. It is one of the single biggest drivers for chronic disease, especially inflammation and heart disease. And so what we need to do as a country is meet insulin resistance head on and make that a priority, trying to manage blood sugars better, because then all the downstream chronic disease can be decreased.
Mm-hmm. And the reason I think a CGM is helpful is because there's no one size fits all, right? Like, yes, we tell people like eat whole foods, focus on protein. There are some kind of standard recommendations you can give, but your body responds very differently to sugars and carbs than mine does. Yep. And so CGM is really, I think, a great tool to really personalize and understand what your body can and can't tolerate as far as insulin and blood sugar.
Yep. Yeah. And if you're here in the clinic and you ask about a CGM, what we'll do is we'll give you a little card for Stelo. It's got a QR code on there. You can just hit that with your phone. It's going to take you through the process of ordering that. Like Jackie had said, each of the sensors that go on the back of the arm and this little fat above the triceps lasts for 2 weeks, and it gives 2 weeks worth of data that can go straight into an app if you download the app on your phone. I wasn't planning on talking about CGMs today at all. All right, what do you want to talk about next?
Another thing I heard commonly in clinic this last month was moms and then women in general, but moms also asking for their daughters about birth control options. I think this is an important thing to highlight because there are a lot of options out there, but they work very differently. And so when we're using things like an oral contraceptive, so a birth control pill, we are getting systemic absorption of the hormones. And what happens is it basically shuts down your body's natural production of hormones and gives it a synthetic exogenous amount of hormones that controls and prevents pregnancy. Yeah. And then we have things like an IUD where that's going to be inserted vaginally and it's going to give off localized hormones, progesterone only. And so it's pretty much only local absorption there into the uterus to prevent pregnancy. Yeah. And so this is a big deal because when we're taking a systemic pill, it's not just impacting and keeping us from getting pregnant. It's impacting our gut. It's impacting our SHBG levels, which then lowers our available testosterone, which is important for moods and focus and motivation and muscle mass and so many things. And so when these younger girls get put on birth control, systemic forms of birth control, it can change them. They can feel like a different person with their mood, or it can change their gut microbiome. And we know the gut-brain axis. And so there are a lot of other potential effects that come from using a systemic birth control versus an IUD. So obviously an IUD is more invasive, but if you have to choose between one or the other, especially for your kids and even, older women, I would definitely go more of the IUD route.
For sure. Yeah. And when you're talking about localized absorption at the endometrial level or that uterine lining, I mean, that's where we're talking about a Mirena IUD, which is typically very well tolerated. And we're not associated with Mirena or IUDs in any way. This is just going through hundreds and hundreds of labs and looking at what is the impact of systemic hormones that get into the bloodstream and then have an effect on the whole feedback loop. And what you were referring to in terms of its effect on how hormones are regulated by that woman is when oral birth control gets absorbed through the gut into the bloodstream, the brain is tricked And there are synthetic hormones, so not bioidentical to what that woman's body makes, that are absorbed into the bloodstream, and the brain recognizes that because it acts like a computer. It's testing those levels every second of every day, saying, okay, do I have enough here, or do we need to send a bigger signal down to the ovaries to make these hormones? Because there's such an influx of synthetic hormones, it shuts down the signaling hormones from the pituitary in the brain, FSH, follicle stimulating hormone, and luteinizing hormone. So what we see on labs is, let's say it is a 18-year-old young lady who starts oral birth control, and her FSH from her brain, that signal, is way low. Like her brain is basically trying to pump the brakes on this whole thing. And then on top of it, her actual estrogen production is super low because she's getting this synthetic estrogen, and her body says, no, we got tons of estrogen, but she's not making any of it because the whole feedback loop is affected.
Yeah, I think it's really eye-opening for patients when they come to me on birth control and they see like, wow, my body's actually not making any estradiol. Like, it's zero. I'm like, yeah.
All right. One thing that I've been getting more questions about in clinic is seasonal affective disorder. And we're, fingers crossed, on the tail end of winter here. We've had a few false springs, but seasonal affective disorder, what are the things that you consider, or just common tips that you'll talk with people about during the winter months to help with mental health, to help with mood?
Yeah, I mean, light, there's different sources of light therapy that can be super helpful for people who are really struggling with that. Obviously, moving your body, being active as much as possible. Beam is a great red light clinic that offers options if you don't want to purchase one yourself. And then feeding yourself with things that lift you up, and worship music. Like, that's one for me. It's like, hey, if I'm feeling down and blah, like, put on some worship music, spend some time in the Word, just do something that brings me joy is so important. Yeah.
It's interesting. You and I probably have a little different approach to seasonal affective disorder, because the things that I look at and kind of my sweet spot or go-to is, what do your lifestyle habits look like? And what's your vitamin D level look like?
Yeah.
Because when we look at the vitamin world, vitamin D is really that mood support vitamin, arguably one of the most important vitamins in the whole body. When we start seeing that number, especially dropping below about 40 to 45, we're not getting adequate mood support. And so having that vitamin D level in that 60 to 90 range is really a great spot to be here in winter, at least from the mood support from a vitamin standpoint. Hormones play a big role in this. Testosterone for women and men tends to be a calm and confident hormone. It does tend to help uplift mood, and that's why we see mood drop off when levels can come down on both genders. And then also, when we look at lifestyle, so mental health can be so greatly affected by sleep, by our eating habits, if we're eating inflammatory foods, and then is that person starting the day with getting outside, or if they can't get outside, at least getting regular activity and getting their body moving. I mean, all of those are things that are going to positively affect mental health, especially in the winter when it's still a little bit cold and cloudy out.
Yeah, and I think people are surprised. I was surprised, I'm not anymore, but like, we check vitamin D. That's just a basic thing that we do for everyone that comes here. And I would say 98%, if not 99% of people that we check are very deficient. Yeah. Like, very deficient in vitamin D. And so it's a simple tool, but it has such a great impact in just overall health, lots of things, not just moods. But so I think that was really eye-opening at first. I'm like, wow, like, literally everyone needs vitamin D here.
Yeah. Yeah. Well, and for everybody listening, your vitamin D3 supplement, so vitamin D, make sure it's with K2. You should have vitamin D with K2. You're going to need to take a certain dosage through the winter when you're not getting adequate sun exposure. You're not going to be making much of your own vitamin D. If you go to Mexico over spring break, leave it at home. You don't need it. Go get some sunlight. Go make some natural vitamin D. But when we're here and when we're cooped up inside for months at a time, all of us need to be supplementing with that. All right. Let's talk peptides.
Okay, let's hear it. What do you got?
So when I look at impactful peptides, I think a lot of us as providers, we kind of get into a rhythm of what we've what we see work and what we see work in specific instances. Peptides that we use the most of here would probably be some of the GLP-1 peptides like tirzepatide, semaglutide. When those are used at the appropriate dose in conjunction with the right lifestyle benefits, they can help with weight loss, body composition, anti-inflammatory support. BPC 157. I love BPC 157 for gut health. It stands for body protective compound. And when we take that in an oral capsule form, especially when that's combined with another peptide called KPV, the benefits for the gut and the gut lining can be huge. And that's really a go-to for me. I've found for people with inflammatory bowel disease. So think ulcerative colitis, Crohn's disease, those two. Those are your inflammatory bowel diseases. Even for people with IBS or irritable bowel syndrome type symptoms can benefit from BPC 157 in a capsular form. Another great one that I've been using a lot of is Samorolin, and Samorolin has great activity on growth hormone, and that's partially why it's used before bed. There are other analogs that are similar to Samorolin, like Tesamorolin, but we are limited and we cannot use those here in Minnesota due to state regulations. So Samorolin can be a little troche. It dissolves under the tongue in about 5 to 10 minutes or so before bed. We'd have a person take that about 6 nights out of the week, or it can be done in the injection form as well. Both are efficacious.
All right, let's pivot a little bit. Let's talk about patient wins. Some of the big things that stood out to us this month with our patients. You want to go first?
Sure. I've only got a couple this time. So I have a male patient. He is in his upper 40s, and he is utilizing a combination of changing up his eating habits. He has really increased protein intake because he's transitioned over more to resistance training now because we're working on body composition. He's also utilizing tirzepatide in a very low microdose. He's using Samorolin before bed as well. And also we're optimizing his testosterone. And he's down about 20 pounds. He is down for the first time below 20% body fat, and he's feeling amazing. More energy, better sleep quality, better cognitive function. So everything's moving in the right direction for him. And now, I won't say we're on autopilot, but he's in a great rhythm where it should continue to yield results for him.
I think it's really fun. We get two groups of people. We get people who are really new to the foundational health world where we have a lot of things to fix and change, and like we got to catch back up to a good place. And then we have like this group where it's really about fine tuning and optimization and longevity. And it's fun to work with both of those. And I think, I've been seeing more of that kind of optimizing longevity space, which is so cool. Like it's fun to be able to use these tools and really see what you're capable of, what your body's capable of when you're doing the right things.
Yeah.
And it's not, just about what it looks like. It's how it impacts the whole, like the rest of your life, like your work, your family, your moods. It's such a cool thing. So it's fun to be able to work with both types of patients, I think.
Absolutely. Well, and it's interesting too. I'm going to get a little bit off topic with this, but one of the things that we drive home is how can we architect a lifestyle for health now and into the future? And the reason being is we've seen that the opposite doesn't work. The idea that if you have high blood pressure and high cholesterol and high triglycerides and insulin resistance, those are dysfunction within an adult body. And so just throwing a pill at those so numbers look better on a page, the only thing that's winning is the page and the numbers. It's not the person's long-term health outcome. So if we look at that prescriptive knee-jerk reaction of for every ill there's a pill, we're completely missing the boat in terms of providing the best care possible, not only long-term, but even short-term too. So that's where we dig into the nitty-gritty with regard to how are you living and does this promote lifestyle and where you want to get to with goals. The other guy I can think of, he's down about 30 pounds now. More importantly than that is that hemoglobin A1C, or that average blood sugar over 90 days. He was well into the diabetic range at about 7.0. And now this is the first time he's been down below 6.4 ever. I think he was at 6.1. And so in a matter of about 6 to 8 weeks, we're bringing that A1C way down, helping his body control blood sugars, lower blood sugar levels, and decreased inflammation by the body. And the goal is within the next 6 months to have him completely out of prediabetes and into a normal blood sugar level. Likely he'll continue losing weight through that entire process.
Yeah. And I think it's important to understand here, it's not one size fits all, right? We have to really dive in with that patient and figure out what's going on with them specifically. But then it's also like, it's work.
Yeah.
It's work. It's not just here's your pill or here's your whatever. The people that we see and that we walk alongside in the type of medicine that we do is they're putting in the work, and we're there to put in the work with them. But I think that's always important to make sure people understand, like, it's not just easy all the time.
Yeah. And this is root cause medicine. Nobody was ever born with a statin deficiency or, I have that nasty lisinopril deficiency. No, you don't. Your blood pressure got higher because of choices that were made. And we're going to try and reverse that to bring you back to homeostasis.
Yeah. I had a really cool 66-year-old female. She started seeing me about 2 years ago, and her primary focus for coming in was bone density. Yeah. So she had been diagnosed with osteoporosis. And as we know, that is a huge risk for women as they age. And many times, speeds up death very, very quickly after a significant fracture. Yeah. And so she repeated her bone density scan after hormone optimization with pellet therapy for 2 years. And she saw an increase in bone density by a total of 9%. Which is, it doesn't sound like a lot. It's a lot. Like, I remember when I was at Align, I used to tell people, we use these medications in hopes that your bone loss doesn't get worse, but it's probably not going to get better. And honestly, when she came, she had just been getting worse and worse and worse with all the traditional treatments. And so she was like, I just want to stay the same. Like, I just don't want to get worse. Yeah. And here we are growing and increasing bone density. So that was super exciting. She was really happy.
It's so important. And to fully grasp what Jackie's talking about, do a Google search and type in this in the Google search bar.
Search it up.
Search it up.
Don't Google it, search it up.
Yeah, that's right. Search morbidity and mortality after hip fracture in elderly women. Search that. And the data that comes, it's mind-blowing. In orthopedics, when a woman over the age of 70 would fall, break her hip, this is an exceedingly common injury. Life expectancy drastically changes right at that point in time of fracture for that individual.
Yeah. All right. My last one, which really stood out to me and I think is so common and probably one of the most overlooked things in just health and being well overall, is toxins. Mm-hmm. I know I talk about this and you're like, oh, here she goes again.
It's your jam.
But it's amazing. And it's amazing the results that we see. So this young lady had come in and she has, I think, like 2 or 3 different autoimmune conditions. She had been to all types of specialists, rheumatology, immunology, Mayo, infectious disease specialty, like just everywhere. And she's having these weird symptoms like hot and cold spells, just like strange things no one could really get an answer for her on. And so I was like, let's do a toxin test. Like, this is the one thing that people aren't routinely checked for, and it can do all of this stuff. Yeah. And so we have to start there. And so she had 46 high toxin load, like 46 things. So we're looking at mycotoxins or molds, environmental toxins, which are going to be pesticides, parabens, phthalates, chemicals, pesticides, herbicides, VOCs, all of those things, and then heavy metals. So she had 46 high toxin levels in her body. So this is a urine test. So it's what you're peeing out. So it's actually there. And 36% of those were known carcinogens. Oh, man. So and I always feel bad when I have these that we're going over, because like it's overwhelming and it's like, oh my gosh, this is in me and it's kind of scary and terrifying to hear about, but we can get rid of them. And if we would never have checked it, you wouldn't know. And that's why, we don't hear about this a lot, I don't think, in the whole cancer talk world. But man, the more of these I do, the more I see, I think toxin exposure, mold exposure, and the link to cancer is so much more than we even realize.
Yeah. Yeah. And this is something too where, I mean, that's an extreme case. That is,
Unfortunately, it's actually not. Like, I see this a lot.
Wow. That's okay. When we look at the growth of prevalence of cancer in this country, there's no way we can turn a blind eye to that and say, oh, it's not due to everything we're spraying on these millions of acres of crops, the environmental toxins, how ubiquitous mold is in work settings on our food as well.
Food's huge. I would say I have more positive mold tests from food sources than I do from environmental sources.
Yeah. And when we look at that, and also things like packaging and plastics, it's no wonder that cancer rates have risen so dramatically here, just because we're all trying to function in this semi-toxic soup that we call the environment, and our body's trying to get rid of and excrete all of those things on a regular basis, but that's a big burden.
Yeah. So that is just, it's such a big piece of health that is oftentimes missed. And so if there's like weird symptoms or you're not sure, like no one can figure it out, get a toxin test.
Yeah.
So we're going to round this out with our supplement pick for the month. What do you got?
Yep. So this is one of my favorites when we are looking at heart health, detox, helping control cholesterol levels. Omega-3 with CoQ10. I like it because it gets you a very high quality omega-3, good fatty acids, along with CoQ10 for heart health in one supplement. And 2 capsules a day with food is what I typically recommend. That's going to be ideal for most.
All right. Mine is Carboxy. So this is the most powerful mold binder that I have found. So if you are worried about possible mold toxicity, maybe you've had water leakage or damage in your home, whatever it is. But if we're working on mold, I'll always have patients on this. It is a powder. It is not the greatest tasting, but it works.
Yeah.
So this along with glutathione. I actually prefer the glutathione injections or IV that we do here in the clinic, but there is some liposomal glutathione that works too. But those are going to be the 2 heavy hitters, and it's getting rid of mold is a process, but this is my favorite mold binder that I see really bring those numbers down by far. So remember, we have the Flourish Collective now online. So easy to get whatever supplements you're needing, whether it's just some vitamin D, things that we recommend here, they're coming from a good source.
Yep. And to reiterate that too, any supplements that we carry, we have tested these. We test absorption. We test quality. We go through the paperwork from the person making or the entity making the supplement. So just know any supplements that you see here, we've done all the legwork on that, and you can trust it.
Yeah. Come from a good source. They work.
Yep.
We see the numbers change.
Got anything else?
Nope.
Oh, you guys, spring is around the corner. We are almost there. Just give it a couple more weeks. We are going to make it. But until next time, everybody, had some fun with this episode. God bless.
Thanks for listening to the Flourishing Life podcast. You can watch the full video version of this podcast inside the Spotify app or on our YouTube channel. If you liked this episode, please rate, review, and subscribe on your favorite podcast app. And we would love it if you would share this episode with a friend and follow us on socials, Instagram, TikTok, YouTube, and Facebook, or on our website at flourishmedicalwellness.com. Chat soon, everyone. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.